Thank you, sir.
Or more than 0.6, or a notch or an asymmetry between the two eyes of more than 0.2. These are the parameters on the slide which were used for comparison between the referrals and records using the standard instrumentation. Patients who were less than 16 years of age or secondary glaucoma were excluded. Statistical analysis was done using mean and standard deviation for the continuous variables and percentages for the categorical variables. There were 146 referrals, of which 31 satisfied the inclusion-exclusion criteria made by 27 ophthalmologists. Mean age of the patients was 56.8 plus minus 12 years. There were 13 males. Tonometry and optic disc assessment was not documented in 35% referrals. Gonioscopy was not documented in 90, and visual fields were not documented in 100% referrals. Regarding the accuracy, 15 of the 20 referrals did not have data about the, 15 of the 20 referrals which had data about the optic disc evaluation concurred with the records. Only 3 out of 3 referrals had data about gonioscopy, and they were accurate as far as the records were concerned. Predictive value was not assessed as diagnosis was not available in most of the referrals. Coming to the discussion, the referral to tertiary eye care services are in high demand. The referral letter is the first point of contact, and it is an essential part of interprofessional communication. Referrals to glaucoma are usually made when there is either a suspicion of glaucoma or when there is an advanced glaucoma which may require surgery. And it is the quality and accuracy of the referral letters which determines the speed with which the patients are taken up at the tertiary center. We all know IOP is the most manipulatable risk factor in glaucoma, and target intraocular pressure requires not only the field and disc changes but also the baseline IOP. In my study, most of the patients did not have information on the baseline IOP. 6% of the referrals in UK in a study done by Scully et al. Did not have information about IOP. Huang et al. Reported that IOP is the most reported parameter in glaucoma referral, but 10% lagged it. In my study, 90% of patients came without gonioscopy. Prasanna et al. At Coimbatore found 95% did not have it, and Verma et al. At Canada found 74% did not have it. In a survey by Glaucoma Society of India, they found that there was a distinct difference between the preferred practice pattern with respect to tonometry and gonioscopy and optic disc evaluation as far as glaucoma specialists and general ophthalmologists were concerned. Accuracy was bang on in my study, even though, for gonioscopy, even though there were only 3 patients whose records concurred with the referrals. Prasanna et al. And Vijaya et al. Found that this accuracy was nearly 60% only. I propose that the baseline IOP should be provided in all the referrals, and they should also mention the tonometer used. Secondly, I also feel that gonioscope is an important part of the armamentarium of the ophthalmologist, and the practice of referring patients for gonioscopy should be avoided. I also feel that the disc should be stereoscopically examined after dilating the fundus. I am proposing a concise template with the patient identifiers and age and risk factors, which also includes systemic diseases, anti-glaucoma medications used, visual acuity, angle status, optic disc examination, and the baseline IOP. I also propose that an electronic checklist with a template be available so that a comprehensive referral can be done by the glaucoma, any person, ophthalmologist, to the glaucoma specialist at a tertiary eye care center. This will foster a more mutually respectable relationship between the ophthalmologists. The limitations of my study are the small sample size and the retrospective nature. In conclusion, I feel that the quality of referrals by the ophthalmologist to a tertiary eye care center leaves much to be desired. And I feel that nearly 100% of the referrals lacked one or the other information. So I have suggested a template. These are my references. Thank you very much for your kind attention.
Thank you, Dr. Smita. That was a nice idea and a nice presentation. Just a couple of questions. One, were all these from full-fledged ophthalmology? Were all these from full-fledged ophthalmology practices,
yes,
or was it from sort of a referral?
No, if you can see my... So there were actually 31 referrals which literally satisfied all the inclusion exclusion criteria, which were from ophthalmologists. It were from 27 ophthalmologists, those 31 referrals. The 31 referrals were from 27 ophthalmologists.
No. My question was, they were from ophthalmologists, but was it from a sort of screening sort of situation where some of them, they'll sit, you have your master health checkup or something?
It is possible, sir, that it could have been from a screening.
So,
I cannot comment on that.
So we are not sure whether they
We are
had
not
access
sure
to all the
whether it is from a
instrumentation.
screening. Yes, sir.
Just one suggestion regarding your template. I think in addition to the intraocular pressure, they should also mention the time at which it's been taken. The tonometry, you have mentioned that the instrument, but you should also mention the time at which.
Actually, I have mentioned it at I have mentioned it at another place. But the thing is, the slide became too busy.
I understand.
So I actually wanted to know what tonometer was used, because many people sent it after doing an NCT. So I have mentioned it in this slide, or I haven't mentioned the times. I haven't.
This is reference is mainly from the government sector or private sector? Actually,
the referrals come from government and private sector.
Private sectors.
I work at a government sector.
the thing is, when you have a systematic reference, so every doctor's facility will differ. Suppose you ask for this thing.
So that is why I included only the references from the ophthalmologist, because as both of you pointed out, if it were from another a person with a basic qualification, it would be different. They couldn't send a comprehensive reference.
This could be from an optical shop where a doctor is sitting and just doing. So
that is why I have suggested a template.